Exclusive. Migrant carers face ongoing exploitation amidst government inaction. The Royal College of Nursing, RCN, is sounding the alarm, revealing a continued torrent of complaints regarding the appalling treatment of migrant carers in the UK. Despite promises of a thorough investigation, the government's inaction is allowing exploitation to fester, leaving vulnerable individuals trapped in a cycle of low pay, substandard housing, and illegal fees. This exclusive report delves into the heart of the crisis, exposing the devastating consequences of bureaucratic delays and highlighting the urgent need for immediate intervention. Nicola Ranger, the RCN's General Secretary, has penned a strongly worded letter to Home Secretary Yvette Cooper, demanding swift action on the promised investigation into the widespread abuse of foreign care workers. This plea follows a disturbing pattern of complaints flooding the RCN, painting a bleak picture of the realities faced by many migrant carers who have dedicated their lives to providing essential care within the UK's healthcare system. Their stories paint a picture of relentless exploitation, leaving them feeling helpless and vulnerable. The urgency of the situation cannot be overstated. The complaints received by the RCN consistently highlight three critical areas of concern. *1. Cripplingly low pay. Many migrant carers are forced to endure wages significantly below the national minimum wage, often leaving them struggling to meet even basic living expenses. This financial hardship leaves them with little recourse to escape exploitative situations, trapping them in a cycle of poverty and dependence. The meager income forces many to live in overcrowded and substandard housing, further exacerbating their plight. *2. Substandard and unsafe accommodation. Reports detail a pervasive problem of migrant carers being housed in cramped, unsanitary, and unsafe conditions. Overcrowding is rampant, with multiple individuals sharing tiny rooms, lacking basic amenities like adequate sanitation and heating. This not only compromises their physical and mental well-being, but also creates a breeding ground for illness and disease. The lack of safe and decent housing exposes them to significant risks and further undermines their already precarious position. *3. Rampant illegal fees. The RCN has documented numerous cases of migrant carers being subjected to illegal fees, often disguised as recruitment charges or other administrative costs. These fees often represent a significant portion of their already meager earnings, leaving them further impoverished and beholden to exploitative employers. This hidden cost further entrenches their vulnerability, making it incredibly difficult to escape the cycle of abuse. The initial promise of an investigation was made last June by the then-opposition Labour Party, following an exposé by The Guardian that unearthed widespread allegations of mistreatment within the social care sector. This exposure highlighted a systemic failure to protect vulnerable workers, revealing a shocking disregard for their fundamental rights and well-being. The revelations sparked outrage and calls for immediate action. Since Labour's election victory, the commitment to investigate has been reiterated. However, the investigation's implementation has been frustratingly delayed. The government's plan to conduct the investigation through a newly established employment regulator, a component of the Employment Rights Bill, has proven slow and cumbersome. The lack of clarity regarding the regulator's remit further exacerbates the delays, suggesting the establishment of the investigation could take many more months. This protracted delay is unacceptable. The RCN's Nicola Ranger emphasizes the critical need for immediate action, stressing that each day of delay allows exploitative practices to flourish. She argues that continuing to postpone the investigation represents a blatant disregard for the well-being of vulnerable individuals who are already facing immense hardship. The lack of swift action sends a devastating message to those who have come to the UK seeking a better life, only to find themselves trapped in a system that fails to protect them. Ranger's letter to Home Secretary Cooper directly challenges the government's inertia, expressing profound concern over the escalating number of complaints and the evident lack of urgency from those in power. The RCN is demanding that the Home Office, in collaboration with other relevant government departments, immediately launch the promised investigation, ensuring that victims are not further victimized by bureaucratic delays. The current situation is not merely a matter of administrative inefficiency. It is a matter of justice, human rights, and the fundamental dignity of human beings. The government's inaction constitutes a moral failure, allowing vulnerable individuals to endure suffering that could and should be prevented. The ongoing silence and inaction from the government are deafening. The RCN's plea is not merely a call for an investigation. It is a desperate cry for justice for the countless migrant carers who continue to suffer in silence, enduring appalling conditions and blatant exploitation. The time for words is over. It is time for decisive action. The government must act swiftly and decisively to address this crisis and ensure that the rights and well-being of migrant carers are protected. Failure to act is not only a moral failing, but also a profound betrayal of the trust placed in them by those who contribute so much to the nation's healthcare system. The stories of these vulnerable individuals demand immediate and focused attention. Their suffering must not be ignored. Their pleas for justice must be answered. The time to act is now.